Hi, my name is Colleen Cannon. I'm a PhD trained clinical psychologist and I practice here in Calgary. I talk to people a lot about food, their relationship with food, and their relationship with their bodies. I've worked with people who are 90 pounds, I've worked with people who are 290 pounds and upwards. Most of them give me the consistent message. They know what to do differently. They know what they should be doing and what they should be eating. What they're struggling with is their relationship with food and their relationship with their body. Or perhaps, as best said by a gentleman I know who would pat his belly and say, I've got about 20 pounds of anger to lose. I help them figure out how to do that. In the year 2000, 65% of North Americans were overweight or obese. That's a staggering statistic. There are at least two major implications of that. One is that 2 out of 3 people are overweight or obese. We can't say they all have deep, unresolved psychological issues with their mother, for instance. I don't do major in-depth psychoanalysis with every overweight person I see. The second implication is that we must be living in an environment where overeating and eating more of the foods that we shouldn't be eating so often has become okay. It's become normal for fast food to become everyday food. If you're trying to make and maintain significant changes in your eating, you're swimming upstream. There's a multi-billion-dollar industry out there trying to get you to eat in exactly the ways that you shouldn't be eating. That's tough to beat, and we got to talk about strategies to do that. One of the primary techniques that I like to use is education, trying to debunk some of the multitude of myths and misinformation that are out there. For instance, the dieting industry, or as I like to call it, the diet circus. The dieting industry keeps people trapped in that cycle of losing and regaining weight. It's called yo-yo dieting. Part of the way they do that is by selling you on the concept that it's a quick fix. If you just buy this book, if you just buy this product, if you just throw something in a blender, you can lose weight without the healthy eating changes and the activity changes that take a lot of time and a lot of hard work and a lot of commitment. There's always a new gadget, there's always a new gimmick out there, whether it's the Atkins diet, the new Atkins diet, or the South Beach diet. Watch for it. Guarantee there'll be a North Beach diet, and maybe even one day the North by Northwest diet. Okay, so we're out of daylight, but we're definitely not out of ideas. We're being resourceful, so bear with the porch light, please. When people are trying to make and maintain such personal and such important changes in their lives, all sorts of other factors, of course, can play into it. Depression, anxiety, assertiveness, learning to speak up for themselves and to use their own voice, goal setting, problem solving, these can be really important factors, and it's my job to understand which of those factors fits with the context of each of your participants' lives. I'm excited about the opportunity to do that. I'm excited about bringing the audience along and helping them see how all of these pieces fit together. My approach with people is direct and it's honest. But I gotta tell you, I'm not going to pull a Dr. Phil. I'm not going to yell at your participants. I'm definitely not going to point at your participants. And with any luck, I will not be saying y'all, certainly not on air. Thank you very much, and I look forward to talking to you more about this.